Hi, thank you so much for everybody that's joined us. My name is Ruby Sanchez. I am the Family Support Services Coordinator at Team Luke Hope for Minds. We are a nonprofit organization that support children who have sustained an acquired brain injury, and we offer support in a variety of ways. One of which is financial assistance. We provide education for the families in the form of support groups in our annual conference. And we also provide emotional support and resources to local and state resources. So I want to thank Allison Schaberg so much for partnering with us to provide information on how to save on medical expenses. Thank you so much for everybody who's joined us, and I will now let Allison take it away.
Thanks so much, Ruby. Thanks for having us. It's good to be back with Team Luke again. Allison Schaberg here, Consolidated Planning Group. If you are joining one of our webinars for the very, very first time, we're super glad that you're here. And if you are what we call a serial attender, you listen to a lot of our webinars, we're glad you're back. And so let me just kind of give you a little bit of housekeeping things. We are in webinar mode, and basically what that means is we can't see you or can't hear you. So in case you're wondering, we can't, but we do know you're there, and we're glad you're here. And so today, you know, from an interactive perspective, we want to hear from you. We want your questions, or if you have any tips or advice that you think is valuable to share with somebody else, you can feel free to put that in the chat box. We are recording today's webinar. Ruby is going to be monitoring the chat box, and she's going to read out the questions as they come in. We'll take them throughout the presentation. We're not going to wait till the end. And if you have a question, don't be shy. Just put it in there because it's a question that probably somebody else has as well. And so Consolidated Planning Group, what we are, who we are, what do we do? We always just kind of take a brief moment to just talk a little bit about that. We are a holistic special needs planning firm. We are nationally certified as Social Security advisors and members of the Special Needs Planning Academy. And we have a YouTube channel, the Consolidated Planning Group. We put that in the chat box as well, so you can check that out. And that's a place where you can subscribe for free and look at any past content. All of our webinars are really surrounding planning for special needs, transitioning, all topics that really matter to this community. Topics like SSI and Medicaid, SSDI, special needs trust, guardianship. I mean, the list goes on and on and on, because the truth is our life is a little complicated, because there's a lot of stuff that we have to know and we're supposed to be the specialists on. And the stuff that we're supposed to know it's pretty complicated. So these webinars are designed to put the tools and resources in your hand, so that way you can advocate for your loved one and make things happen and kind of control the destiny a little bit on some of those things. So we always hope that from these webinars that you can take, I always call them nuggets, like 2 or 3 nuggets that you can take away and implement as it relates to what you have on your plate and what you're dealing with to help hopefully improve your situation as well. So some of the things that we do at Consolidated Planning Group, we do protection plans, lifetime care plans. We do transition planning and future care cost estimates. Some of the families that come to us, they know for sure that their child is going to have care needs for the rest of their life, the child's life, not just the parents. And they need to know, how much money do we need to have in a special needs trust? What does this look like? How do we do that? What do other people do? So we're able to help with all of those things. And we have specialized software that puts those analysis together, and they're completely tailored specifically to your loved one's needs, your family's needs, and to your goals. We're also able to help open ABLE accounts for families. An ABLE account is a place that you can have money that will not be counted against your loved one as it relates to the means-based test for SSI and Medicaid. And then, of course, just like these webinars, we're here for advocacy and, kind of helping you move the bar, right? So today, what we're talking about, we don't talk about this very regularly, and I think we should do We should probably do a better job of that. We should probably do this a little bit more often. But we're talking about how to save on medical expenses and how to navigate this. Because the thing is whether you're like a veteran parent and you've had, a child with a disability for a long time or complex medical care needs, or you're new to this rodeo and you're really feeling overwhelmed. The thing is the complexities that come in with health insurance, billing from hospitals and facilities and things like that, and understanding all of the nuances that go into that and what to do when things are going awry, because they do go awry. It does happen. Those are the things basically that we're going to be talking about today. And so, I come to you as a parent. I have two kids with disabilities, and I come to you from a perspective of and a lens of kind of going to the mailbox and opening up, a giant 8.5 by 11 envelope that was like, a half-inch thick, which were all bills. And it was kind of on the heels of an ICU stay and a ventilator and a helicopter, and things get bad quick. And I know you guys already know that. And but the bottom line is yes, I had insurance. In fact, I had multiple insurance coverage, health insurance coverage, and the bill was $256,000 that they were billing me. You talk about shock, and like, I don't know, it's just so overwhelming. And then, or if there was a traumatic brain injury because of an accident or something like that, where you had a child that was neurotypical and we went from neurotypical to things aren't great, right? And that's kind of how we went. We went from everything was fine and normal to everything wasn't fine and normal. And so, if this is your first rodeo, it's hard. You're overwhelming. I remember sitting in the ICU and thinking, oh my gosh, does our insurance have a cap? Because back then there was a such thing as these caps, and there's still a such thing, but it's more on those health sharing organizations than health insurance. But back then it wasn't abnormal at all to see a group health insurance plan or a private health insurance plan have $1 million cap. So once you've hit $1 million, then it just doesn't pay anymore. Well, I mean, we probably were upwards, close to that within the first 3 weeks of of our stay. So is, just kind of learning how to navigate that. Okay, so do we have a question?
We do. And someone said, my daughter is 12 and autistic. For 1.5 years, we have been doing ABA therapy through Zoom parent training with an approved provider through our insurance. We have good insurance, the UT employee plan through Blue Cross Blue Shield. I have submitted multiple claims on this to the company as they instruct, and we have heard nothing in return. What should I do next?
Okay, that's a great question. So first things first, if you've got group health insurance, first things first, reach out to your HR department, who is the provider of the group health insurance. So for instance, if you work for Exxon, then call HR at Exxon and kind of talk to them about the problem that you're having, because usually they have like a corporate liaison with the insurance company that can move mountains. Okay, so that is one thing to do. And so furthermore, they have to respond to the claims. So there's laws on that, on how many days that they have to respond to claims. But I think logging in to see, did they receive your claims, looking at your EOBs, we're going to talk about all of this too, but to see what is going on. Were the claims denied because they applied it to the deductible? If there's no EOB in there and you can't find the date of service in your portal for Blue Cross Blue Shield, then it's a pretty good possibility that they don't have the claim. And so that's where you would call to Blue Cross Blue Shield and say, look, these have been sent in multiple times. This is where they sent. I have proof that the fax went through, and have somebody run them down. That can be some of the problems as well. So that is a great question. We are going to go deeper on that. So what if insurance is denying claims? And what do we even do? I mean, so whenever I went to the mailbox and I had this bill for $256,000, it was all claims that had been denied by the insurance company. And I just couldn't figure out why, because I was in the same boat. I had great insurance. Not only did I have one group plan, I had two group plans. And why? I should owe zero. What are you talking about? $256,000, right? And so, I mean, there could be, and when you've got kind of a stack that thick of bills, and in an accident or an injury, in an acute thing, it happens quickly like that, right? And other times they're just kind of one-off appointments here, surgery here, you know, a procedure there, something like that. But it could be a number of things. Like it could be, so in our example, what was going on was that one insurance company knew that the other insurance company existed, and both insurance companies dug their heels in to verify the other insurance coverage, and basically both insurance companies denied all the claims. So it was kind of simple, but not. And so we're going to talk more about what happens when you do have multiple insurance, because a lot of times what we see is sometimes people have multiple group plans, and if they've got a kid with complex care needs, they cover the kid twice on purpose. And then sometimes there's a group plan, and then there's Medicaid, and then there's Medicare. So we're going to talk about all of that because it really starts getting confusing. So the first things first, we want you to get organized. We want you to keep and organize your bills by facility. Keep and organize your explanation of benefits by date. Now, this used to be easier because they used to mail them, but now they're all online. So if you don't know, or if you've never logged in, for instance, everybody, United Healthcare, Aetna, Blue Cross Blue Shield, I don't care who your carrier is, they have a portal. You have an online portal that you can sign up, you can register for, and it has all of your family's claims or whoever's covered by the plan. It has the details of your plan. It has your deductibles. It has how much you've met towards your deductibles and out-of-pocket expenses. So your lens to see everything is right at your fingertips. So you got to set that up. And most places do not mail EOBs anymore. So you're going to want to match your EOBs to the facility bills and make sure the amount owed is actually correct. You got to check those facility bills. There's a lot of, I don't know. I don't even know how to use the word. There's a lot of misbilling. It's not correct, or double billed, or perhaps, you guys have seen things. If you guys have ever done a surgery where they bill you for the surgery, and then you're getting bills for anesthesiology, and you're getting bills for radiology, and you're getting bills for the lab and things like that. But sometimes you're getting billed for a doctor or a facility that was involved in the surgery as an assistant you didn't even know about, you didn't necessarily authorize, maybe they're out of network. So the thing is you've just got to get down to it. But you know what happens is people are feeling overwhelmed. You're here because you've got serious stuff going on. You've got a loved one with a disability. Your life is complicated. And then you guys get these bills, or you get these denials, or you have these claims that are not being paid, and it's like seriously causing you to lose your mind. I mean, I've got right now, myself, I have $50,000 of pending claims right now of out-of-pocket expenses that have been pending for almost a year. But what it came down to, it had nothing to do with the health insurance company not receiving the claims, had nothing to do with us. What it had to do is that the doctor had the procedure codes were wrong. and then they were resubmitted, and then they were wrong again. It's like this kind of this cat and mouse game, but it could be any number of things. So you've got to get down to it. And sometimes some facilities or more individual practices get sloppy on the codes. And especially if you're going to a specialized facility that are a specialized doctor that does things that are kind of outside of the 9 dots and all of, I know a lot of families that do that when they have complex needs, and we've tried all of the other methods and methods aren't working and those types of things. So that can happen as well. So we want you to keep a list of phone numbers handy to the facilities that you owe and the various departments of your insurance company. And always, always, always make a note of who you spoke to, the date you spoke to them, who you called, and just kind of a brief description of what they said they were going to do and what you said you were going to do, because it all starts running together. Because some of us have bills at multiple facilities, not just one. You know, we've got a lot of stuff going on, so you got to keep this together. So get organized is the key thing. So why is health insurance so confusing? So that is the truth. It is confusing, and you've got to understand your medical coverage. And by now, I would say probably a lot of you already know these things, but sometimes there's terms that these insurance companies throw around. They love to talk in acronyms, and they love to throw around terms, and it's just pretty confusing. But first things first, we talked about maybe having multiple plans, multiple group health plans. So who pays first if you have more than one plan? Well, you're going to have to call your plan provider. So in the example, if it's Blue Cross Blue Shield or United Healthcare, and find out if there's multiple group health plans, who pays first. Sometimes it goes off of who is the older, or I've seen it go off of who was born on an odd or an even year. Like it's kind of quirky how it works. It's not necessarily whose coverage is better. So having said that, if you're thinking about adding, so maybe as spouses, you both are eligible for a group health plan. And because the complex medical needs are so much, you're thinking, hey, it'll be great. It'll save us money if we actually have double coverage. And the truth is sometimes it does and sometimes it doesn't, but it depends on who the primary payer is. So if the primary payer is the one that's not as good, then the secondary payer comes in and basically pays the rest, right? That's basically how that works. But if the primary payer is the good group plan that pays more, then what happens is the secondary group plan comes in and says, oh, well, they already paid more than what we would pay anyway, so we're going to pay nothing. So that's why you got to be careful on that. So I just wanted to check in with you on that. But then let's talk about, what if you have a group health plan, Medicaid and Medicaid? So Medicaid is always the last payer. So that's the key for anything. So no matter how many plans you have, whether you have Medicaid, Medicare, and a group health plan, Medicaid always pays last. So if you have typically, and it's not 100% of the time, but typically, if your loved one is eligible for Medicaid, Medicare, and the group health insurance, typically Medicare pays first, your group health insurance pays second, and Medicaid pays third in that example. And there are some one-offs that it doesn't work that way. So Medicaid, some of our kids are covered under Medicaid under MDCP. Some of our kids are covered because they're over 18 and they qualify for Medicaid under through the Social Security Administration under SSI, and it comes with Medicaid. But when our kids get Medicare, how do our kids get Medicare? Because sometimes families are confused on that, and these terms, they sound similar. But when your kid gets Medicare, there's a couple of reasons why your kid might get Medicare. And it's A, one or the other or both parents are already drawing Social Security disability. Okay, that's one. Your child is over 18, and if that's the case, then after 2 years, they'll be eligible for Medicare. The other scenario where your disabled adult child will be eligible for Medicare is that one or the other parent is drawing Social Security retirement, okay? At which time, again, as long as the individual is over 18 years old, one of the parents is drawing retirement after 2 years, then they'll be eligible for Medicare, and they'll be considered concurrently enrolled in Medicaid and Medicare. Just so you know, I know that was a mouthful, but I just want you guys to know how that all works, because a lot of our kiddos do qualify for Medicaid and or Medicare, and it does come into the factor. A lot of our families say, and this is going to be dependent, like on what your situation is. You know, if you've got a child that is fully dependent, maybe they're on a ventilator, maybe they have a trach or a G tube or any of the things that are really complex care, then Medicaid is your friend, and you might be getting attendant services. There might be getting things that are super, super important to your family. that Medicaid is covering that maybe other insurance doesn't cover. But a lot of families are not huge fans of Medicaid because they say that the providers that are in Medicaid a lot of times are not the providers that they want to take their child to. Most facilities, most hospital facilities, like your Baylor's, your Texas Children's, whoever they are, they're going to take Medicaid. But Medicaid, what Medicaid does often is it kind of swoons in, it pays your deductible. So like say for an example that your child needs an MRI and your plan has just turned over, it's January 1st, your plan has just turned over and your deductible for for the whole family is $6,000. I'm just using an example here. The example in that is the primary insurance would be the first payer, and the primary insurance would basically not deny the claim, but they would process it towards your deductible and essentially pay nothing. Then basically what would happen is Medicaid would come in and cover the deductible is basically what's going to happen. So you could still end up paying nothing in that example. So you want to know how your plan is going to pay. For instance, is this 80-20, 90-10? Is it pay 100%? And what is your maximum out-of-pocket annual expense? So the annual expense, the maximum out-of-pocket typically includes your deductible and then that percentage. So in the example that you pay 80-20, so your deductible goes towards your annual expense. Also, your 20% out of pocket that you're being billed, that's going to go towards your maximum out of pocket. Most plans, once you've reached your maximum out of pocket expense, that's it. It is the maximum out of pocket, and your plan goes to 100%. So, from a strategy perspective, and this might sound crazy, but from a strategy perspective, you might want to think about, like, does your child have to have scans annually? Are there particular scans or particular procedures or particular things that happen annually that have to happen annually? Okay, well, if that's the case and you have private health insurance and you have Medicaid, well, you might want to schedule that pretty close to when your plan turns over in the beginning. So that way it's applied towards the deductible. Medicaid comes in and kind of swoons in and pays the deductible. And then pretty soon you're pretty close to meeting 100% of your out-of-pocket maximum. So that way for the plan year, the point is to get to 100% quick. So that way the insurance company is paying the bills and not you. So you can be strategic about things like that. So you want to know, what does your plan cover, and more specifically, what does it not cover? And we talked about a minute ago about, is there a lifetime maximum that your carrier will pay? And this is sometimes true. We have seen things like with health sharing organizations. You might have heard of like Christian MediShare or Altrua or some of those other things. And a lot of times there are maximums on that, but we're not typically seeing that on group health plans anymore. And does your plan have a preferred facility, or can you go anywhere? Is your plan an HMO or is it a PPO? So the preferred provider network. An HMO typically, not always, but typically means that you're going to have a referral to a specialist. So you always have to go to your PCP first to get a referral to a specialist. A PPO, you can go to a specialist directly, but they want you to stay in your network. So another thing that you need to know, because for a lot of the parents that we know, we need to take our kids where they need to go. So whether it's in network or whether it's out of network, yes, it matters, but at the end of the day, we need to keep our kids alive, right? So if they need to go somewhere that's out of network, then we tend to take them. And so if that's you and you tend to fall in that category, first of all, if you're out of state, you got Medicaid, it's not covered, just know that. And then you want to know how the out-of-network coverage is going to work for you. Does it ever go towards the out-of-pocket expense? Can you ever, do that? Like some of the plans with Blue Cross Blue Shield, we know that the coverage, so maybe your coverage was 90-10, or maybe you've hit your out-of-pocket expense and you're at 100%, but then you went out of network and the coverage on a lot of those plans is 50% is what the insurance company will pay. So you just want to be aware of that and kind of know what you're dealing with when you're going in and go in with eyes wide open. And another big thing, and things that we've seen in some mistakes, is, does your plan require coverage to be pre-certified, prior to services being rendered? And this is common for radiology services as well as procedures. So surgeries, expensive MRIs, scans, PET scans, other things like that, they usually need a pre-certification. Most of the hospitals and facilities are pretty hip to this. 5 years ago, they weren't doing as good of a job, and things were slipping through the cracks, and people were definitely getting bills for things that the hospital should have got the pre-certification. They have entire departments for this. So when we're talking about employer-sponsored health plans, we've got HSAs, FSAs, and other cafeteria plans. A lot of your employers have an HSA or an FSA. They may have a dependent care spending account, a health savings account. These are all things that you might want to look into. And if you know your deductible is $6,000, put as much into the HSA that you can, because that way when you are having to pay bills, you can pay that out of the HSA account. And then that also helps from a tax perspective as well. So just be smart about that. And you're going to want to read your plan and your plan documents carefully. I'm not just talking about at open enrollment when your employer sends the little booklet out and you have plan A, B, and C, and plan A is the most expensive and B is second, and C is the cheapest, right? There are plan documents. You need to read the plan documents, and that is especially true if you have a kid with complex medical needs. You want to really see, what are they denying? How are they denying it? What is the wording and what is the verbiage? Okay, so for instance, here's an example that we went through. We had a group health insurance plan that basically said that they would never ever do cord blood harvesting or storage. Okay, it was just like an excluded expense. It's not going to happen. Well, I got the plan document, and so I read all that, and I remember, the facility, they're like, they're not going to pay for it. And I said, oh, they are going to pay for it. And so I got the plan document, and the interesting thing on the plan document is on several areas in the document, it said how they were never going to pay for it. And then there was one little page that basically said, we're not paying for it unless it is medical necessity due to a family member or something like that may be eligible for transplant, or some little sentence. It was like this one tiny little sentence. And I'm just here to tell you, yes, they did pay for it. The lady at the hospital was like, you need to come work here. But they did pay for it, and they probably changed the manual after me, okay? Because probably what they did is they used to pay for it, and that's what they used to do, is if it was medically necessary, if there was a person that needed a transplant, blah, 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 if the diagnosis was in line. And then they probably changed their mind a few years later and took that completely out and said, we just don't cover that anymore. But they forgot to change that sentence. So I held their feet to the fire, and they did pay. They paid 100% of it, because we did meet that criteria. And like I said, they probably changed the manual after that. But there's little things like that all the time. So just know that and know how to read that. And these things come, and they can be overwhelming. These plan documents, they could be several hundred pages long and in a PDF. You can ask your insurance company to mail you a copy. They can email you a copy of the PDF, which I'm a fan of emailing of the copy of the PDF. I mean, if you want a hard copy and that's how you roll, that's great. But if you've got the PDF of it, the cool thing is you can search. You can pull up the search box and you can search exclusions. You can search some other things. You don't have to read every single page. So you should use your funds from the HSA or other cafeteria plan first. If you've ever saved money in the FSA, the HSA, or the dependent care spending account, you should kind of use those things first. So deducting the expenses done after the HSA funding is depleted, just so you know. Okay, so another place that you can get some help, and you may have heard of this before, the Patient Advocate Foundation. They're a good organization. So if you're running into snags, your health insurance has denied your claims, you've checked with your HR department, and they're not helpful. You've called all the people that they've told you to call, and you're hitting some brick walls. The Patient Advocate Foundation is a good place. You can connect with services. They may have studies or other things that you could get involved in. So if you have a complex medical need, or you've been told by one facility they got nothing, the Patient Advocate Foundation is a good place to just check in with, and they can give you they can lead you in the right direction in a lot of different things, and they may be able to also help with some of the billing issues as well. But what I would say is, on the billing stuff, you can handle this. It does take some time and some discipline, and you got to have a plan, and you got to work your plan, but you definitely can handle and navigate this. So let's talk about some of the myths with medical bills. One myth is hospitals will never send you to collections as long as you pay something. I bet you everybody on this webinar has heard that before. As long as you send them something, they can't send you to collections. That is not true. That is not true. That is not true. The reality is the hospital or facility had to agree to the payment plan, which means you had to seek out a payment plan. You have to call them. You can't just get this bill for $256,000 and send them a check for $20 and expect them that they're not going to send you to collections. So you've got to call and negotiate that. We're going to talk about that. Here's another myth. You should pay all the bills for your adult family member. Okay, so I'm an advocate of, doing the next right thing. That's how we roll and what we do. But if you've got an adult with a disability that is, they're getting SSI, they're getting Medicaid, they're getting QMB, they might be getting extra help for prescription drug plans and things like that. They're otherwise indigent. There are financial assistance programs out there for the indigent. And what I want to say is there is also help for others that maybe aren't indigent. You have to ask, okay? You have to ask, and you have to tell your story. What is your story? Is this one of 10 different facility bills that you're juggling? Did you have to quit your work because somebody had to be a caregiver for this child? Did you lose group health insurance as a result of losing your job? These are all things that happen to people. It's the reality. Sometimes people move across the United States because the care facility that their kid needs is in another state, right? And so you have to be able to tell your story, but just know that these kids that are 18 and over, this is their bill, and we need to help them apply for financial assistance and get this bill wiped out, reduced, or negotiated. So just be aware of that. All right, working with billing departments. So this is kind of an important part. So bottom line, be an advocate for yourself and your loved one. And when you don't understand something, ask. Don't always accept the answer you're given either, because a lot of times they're wrong. Ask again. Hang up on them. Call back. Get somebody else. If it sounds crazy, it probably is. All places have new employees too, and they're training and they're learning and stuff like that. So don't be afraid to ask again. And so just remember that the people in these facilities are quite often in a call center. They themselves oftentimes are not able to give you the satisfaction that you're looking for, so don't give up. And this is the key thing. This is a key nugget. Learn to ask politely to speak to a supervisor. So first things first, you got to know when it comes to these bills that are coming. So let's just talk about what sometimes people do. Sometimes people are overwhelmed. They're overwhelmed with the situation that is going on. And then these bills come and they open them up, and it's kind of an eye roll. The bill is wrong. They didn't bill the insurance. They're charging me for things that didn't happen. And you put it on the shelf because you're mad, you don't have time, and you're just overwhelmed. And you put it on the shelf to something that you're going to deal with later. And then later doesn't come. And then, basically the next thing you know, they're sending you to collections. So the thing is be proactive, open those bills promptly, look at the bill, go to your health insurance, download your EOBs, compare them like we were talking about, and then call the facility and get yourself set up on a payment plan. It's okay for you to have in mind what you want to pay. And so maybe it's not what you can pay, it's what you want to pay. Maybe I want to pay $100 a month. or maybe it's $50 a month, whatever that is. Don't be ridiculous, okay? But you know, if a lot of times what these facilities are trained to do is to do 1/12 or 1/18 or 1/24 if they're going to spread it out over 2 years or 3 years. It's usually 12 to 18 months is how they're going to spread it out. And they may have made more provisions with COVID, I don't know, but you got to ask. So what I'm saying to you is when you call that call center person on the other line, they're allowed to do the 1/12 or the 1/18. And so, okay, well, 1/18 of 20,000, that's not exactly what I had in mind or whatever. So you can say, well, I really appreciate that. But the bottom line is I absolutely cannot afford that. And what I can't afford is X. And you're going to tell them I can afford 100, I can afford 200, I can afford $50 a month. And I realize that you might not be able to grant that for me, but what I would like you to do, if it's okay, I would like to be escalated to a supervisor because I know that I got to get a special approval for that. And then they're going to say, yes, that's exactly right. Can you hold on? And then they're going to come back and they're going to say, guess what? There's no supervisor available right now. That's usually what happens. But I have escalated this and the supervisor will call you back within 24 to 48 hours. And they actually usually do call back. And if they don't, then you need to call back again and do this again. And then most of the time, the supervisor will approve that. And then you're going to get something in writing. You have proof. You've got this payment plan. So here's the interesting thing, you know, and we are, you know, a special needs financial planning thing. So most of these facilities, I've seen one in the last year that has moved to interest, right? Most hospitals don't charge interest on their bills. So if they will put you on a payment plan, why wouldn't you do the payment plan if they're not charging you interest when your money could be earning interest? So that's just a thought. So think about that, because even if you've got the 20,000 and you hate to part with it, I'm not a fan of stroking a check for $20,000. I'm not a fan of that. Another thing that you need to know is that a lot of facilities don't get paid, and they want to get paid. So it is worth it when you call the billing organization and to ask, do you have a discount if it's paid in full? I've seen discounts if it's paid in full up to 50% of the bill. Yes, if you pay it right now, guess what? It's half. Okay, so that is something that you just need to be aware of. Most people don't tell you that. And then also, just there are a lot of not-for-profit organizations that specifically help patients with various diseases and conditions. And sometimes they'll have small financial aid grants to applicants that qualify, and it could be disease specific. So just look at that. So another thing that I want to talk to you about, and I don't even think I put this on the slide, but all of these hospitals have like charity care application, financial assistance application, I need help application. They don't tell you about that. It's not in their bill when they send it. And if you can't pay this, oh, by the way, you got to ask for this. So you need to ask for it. So what if you make a lot of money? Okay, I don't care. You can still ask for it. Okay. Can you tell your story? What is the story? Did your house flood with Harvey? Was there a terrible accident? Has there been a job loss? Has there been insurance loss? Has there been a death in the family, a primary breadwinner? Like whatever your story is. So even if you don't meet the criteria from a financial perspective, like they have criteria, you know, clearly if you're indigent, you're going to win every time and they're going to approve it, right? And when they approve it, they can approve any number of things. So we've done advocacy for folks in the past, and we've had where we've applied for this and the person made more money than what the criteria was. But we wrote a good letter and we told a powerful story and what the real situation was. And we've had bills completely wiped out to zero. We've had bills, you know, reduced to, you know, 15 or 35% of what the actual bill was. We've had, you know, all kinds of things happen as a result of this. But you know what it is? You have to do this. You have to follow through. You have to know that if you have decent income, that you might get denied, and don't take the denial personally. You should expect to get denied the first time, because most people that get denied for their asking for assistance don't go back to the well, right? So if they were denied, they don't ask again. But a lot of times we've had people that were denied on the financial assistance application where we sent a follow-up letter, and it basically said, no, I don't think you understand. I sent a letter previously and I was denied, and I just need to convey the situation a little bit further. I don't want to mess up my credit. This is important. We pay our bills, but our situation is bleak and we need help. And I'm asking again for help. And I'm asking for this to be escalated to the board. I've never seen the second letter get denied, ever. They've always come back and do something, which is way better than where you're sitting to begin with. So just think about that. So as far as talking to the facilities, correspond with facilities in writing, and they must respond to written requests. Then you have a paper trail. The billing departments have gotten pretty good of when you call them, they'll send you an email or an agreement of the statement or of what the payment plan is or the agreement. If you made arrangements by telephone, you're going to ask them to send a copy of what they agreed to in writing, because you don't want it to be a your word against them later. And you do not want to let the bills go to collections. Don't do this. It's a bad idea. Once they've gone, it's too late to make arrangements. You'll have to make arrangements with the collection agency, and it's going to hit your credit. So we already talked about, don't put this in the pile of deal with it later. And you need to do what you agreed to do when you agreed to do it. So if you said you're paying them $200 a month, you need to pay them on time every month. Set it up in your bill pay on your online banking so it goes out and it gets paid every month, because you falling short on your agreement is going to, it can null and void the hospital's agreement and cause them to send you a letter of saying, hey, everything's due now. We tried to work with you and you didn't do what you were supposed to do, so now it's due now. But so be persistent in your efforts, and again, it's your credit, so think about that. Because sometimes people are mad because the bill is wrong. They were billed for something that was incorrect, or they didn't charge the insurance. But I don't let your anger get the best of you. Put your patient's hat on and just realize it's just a mistake, and you stay calm, you get it corrected. Because in the end, if you throw up your hands and you say, forget it, I am not paying them, they're idiots or whatever, it's your credit. It is you. It is hurting you. You're not hurting them. They write it off, right? So just be thinking about that as you're thinking of your action plan. So today, for everybody that is signed up for today, I am also, so you're going to get a copy of today's slides, but you're also going to get a copy in a Word document copy of a sample letter of what you can write to the facility requesting the financial assistance for medical bills. So when you call them, you can ask for the application. They'll typically email you the application for financial assistance. Again, it can be called charity care. It could be financial assistance, any number of things they'll call it, but ask for that help. Some facilities will have that application on their website. Most of them do not. Most of them make you call for it. But this is just a sample letter of what you can write. And I've just made it, and we're going to give this to you in a Word document, like I said, so you can edit it. I'm going to stop my share just for a second so I can share my screen for the letter. But you can edit it and you can tell your story accordingly. And I say I'm going to, hold on one second. There it is. So this is a PDF, but we'll give it to you in a Word document. But so this is the letter. So when you fill out your application for financial assistance, I always suggest that you have a letter that accompanies it, because the financial assistance application is finite. It asks what it wants to know, and you have to submit what it tells you, and don't lie. Be honest on the application. That is good advice. Don't lie on it. But that application is finite, and your letter tells your story. And so that's what this is for. And we're just giving that to you, because a lot of times people just don't know what to say. But this is just an example. So you can tweak this and make this your own. And then go ahead and submit that with your application. So we just wanted to help you with that today. Let me get here. So that's just a good place, so you don't have to feel like, because a lot of times, again, people are not doing this because they're like, I don't have time for this. I don't know what to say in the letter. I don't even know how to fill out this application. It's just overwhelming. Well, they make the application difficult, so you get this financial assistance application and you think it's going to be 1 or 2 pages and then it's 12 or something ridiculous. And, and then, because if they make it hard, then people don't fill it out, right? So that's some of the things that happen. So just play the game is what I'm saying. Okay. How are we on questions, Ruby? If anybody has any questions, put them in your chat, in the chat box. You guys have anything that you want to discuss or any kind of roadblocks that you guys have run into, we definitely want to chat about those. Are we okay for now?
We are okay. There hasn't been any more questions so far.
Okay, perfect. I'm trying not to disconnect this, but these are always falling out of my ears. All right, so taxes. Know what is deductible as it relates to medical expenses and when to use it. It's 7.5% of AGI is basically what is deductible. So a lot of our families, when you take into consideration that their income that is significant, having 7.5% of their adjusted gross income, they're always under, right? Like they always miss out on being able to deduct these medical expenses. But just understand that not all medical expenses are deductible. Your alternative medical procedures and remedies may be deductible if you follow some of the rules. You want to keep those receipts, and you want to work with a tax professional on this that understands and knows what they're doing as it relates to this. Some of the questions that I get is, people talk about private school. Is their nanny covered? If their child goes to a special needs school, is that covered? And most of the time that's not covered. And it just depends if they're providing medical services. So in the example where we have a kid that's on the autism spectrum that is going to an ABA school, and basically what's happening is ABA all day, every day, then there might be some things that are deductible for that. When it comes to a nanny or a caregiver, it kind of depends on the level of care that they're providing and if they're certified, if it's a nurse, if it's, a CNA or an LPN or things like that, as opposed to randomly hiring a babysitter and calling them a nanny or whatever you want to do. So that's a slippery slope, and we just basically say, be careful. But there's the IRS publication 502 on medical and dental expenses. So you can familiarize yourself with that or work with a CPA to just see what is deductible, but don't get in trouble with that, but just know those numbers, okay? So it's 7.5% of adjusted gross income, and that's where you can itemize. So not every medical expense is deductible. And so you're just gonna, again, do you have prescription of the medical condition from your physician? Do you have a receipt or a statement for the treatment or service? There's a lot of different things that you're gonna wanna look at to see. But what I would say is focus on the bill, focus on the billing, focus on getting it paid, focus on getting it set up on a payment plan, focus on understanding your EOBs and understanding the bill, because again, most people are not hitting that 7.5% of AGI. So it's good to keep your receipts if it's going to be significant. Like, the years that we've had significant expenses, I've really kept up with all of that because we definitely could, put that on the taxes. But the other years, a lot of times you're not gonna hit that. Okay. So from a perspective of the medical billing and kind of medical bill advocacy, we've kind of talked about a lot of things that you can do kind of to implement on your plan and your journey. One thing, one of the ladies I mentioned earlier today on the autism spectrum and ABA therapy, that's been an issue. Okay, that's been an ongoing issue. It's been an issue where Medicaid wasn't paying for those services. And then a lot of insurance companies are minimizing the number of services that they can get per week, per month, per year. So that is an ongoing thing, and it is being looked at. But don't give up on that. And again, don't throw in the towel. Get to the point where it's next. If you can't help me, then I need to speak to someone who can. It's a supervisor. It's to the next level. It's to the next level. And one time, this is kind of a funny story, but I was having an issue with a particular facility for a long time, and I kept calling and I kept getting people that weren't educated in the situation, and they couldn't help me, and they're going to call me back, and then they never do. And in the meantime, it's kind of spinning and spinning and spinning. So anyway, I went down there to their billing facility, and I knew who the person in charge was. And I asked to speak to her, and they're like, do you have an appointment? I was like, no, I do not. But you know what? I have been like contacting you guys for 3 months, and I'm not going anywhere until I speak to her. I will speak to her or someone equivalent to her, and I need help. I need to make this go away, and I'm unwilling. I've been very, very patient. I'm not doing this anymore. And so as it turned out, that meeting went really, really well. And there was a comedy of errors that was happening at the facility, and it was a major hospital system that was happening. And this lady was really wonderful. And what she did is she appointed me my very own person at the billing department for this particular facility. So from that point forward, I called this person. I'd leave her a 5-minute voicemail. This is what's going on. This is the problem. This is how I need you to fix it. Can you call me back? And then she would call me back and leave a voicemail. You're exactly right. And I did see this. I had fixed it. And so it's like, so I pushed, but we succeeded, and we needed that. I needed that. We had a kid with very complex medical needs that weren't going away anytime soon. And it was one claim after another of thousands of claims, and I needed that. And so that's what can happen as you advocate, as you move things along. That can happen for you too. You can ask for that. Listen, we've got a lot of claims, and what I find is I'm having to tell the same story over 100 times every time we call this billing facility. Is there one person that I could be appointed to because of our complex care needs? It's worth asking. They might say no, but they might say yes. So just check that out. From a special needs perspective, these are all things that should be on your special needs planning radar. These are all things that we have webinars on these various topics. And the thing is all of these topics, there is enough information on all of these topics to have its own hour-long webinar, so they do. We have some that will scratch the, tip of the iceberg and kind of give a little bit of details on, but then we have, specific webinars on those specific topics. So if you're wondering about SSI, Medicaid, SSDI, we can help with that. If you want to know more about special needs trust and guardianship and when do you need what and that kind of stuff, we can definitely help you with all of those things. But we always just provide this list at the end of our webinars because as we're navigating all of these things, it is a lot. It's a lot to take in. You feel like you're drinking from the fire hose. People call us every week saying, I just don't even know where to start. So just help me. Help me align my steps here, because I know I got a lot to do, but help me align. And not everybody can do everything that they need to do all at once, but having a plan and kind of knowing what steps you need to take next is definitely an important part of the process. I always like to say here, meet my team. We work on a collaborative team at Consolidated Planning Group. All our staff is not pictured here, but a lot of times I'm doing the webinars, and I always like to just take a moment to introduce the other members of our team, so you've got some faces and names to go with them should you move forward with an initial consultation with us. Our consultations are always free, so we want to hear your story. We want to understand where you're coming from. And what your needs are. So we seek to understand that, and then we can provide guidance from there. Everybody's situation is so unique and so different, and all pose different sets of challenges. So we're definitely here to help you with that. We're very networked with other organizations all across the state of Texas that may be able to help you, and understanding more about your situation will help guide us in providing tips and resources to you that might be helpful in your journey. So having said that, that is all I have for today. And if you guys have any other questions or any other topics that you wanted to chat about, please just throw that in the chat box right now, and Ruby will read that out.
Thank you so much, Allison. The information you provided was very helpful. I really appreciate the little nuggets that you share to help families better advocate for themselves. It's very useful.
Absolutely. I just always want to say, don't give up. I mean, I sometimes I say, well, I'm a tired mom too, guys, so I've been there. I have done this, and it is frustrating, and you are not alone, and you're not crazy, and you're not undereducated or any of those things. It's hard. It is difficult. It truly is. But I hope, if nothing else, you walk away today encouraged and empowered, and just know that you can do this. And if you're hitting a brick wall, you can certainly call and reach out. We'll talk to you about that. But again, today you're going to get the slides, and you're going to get a copy of that Word document letter, that sample letter that you can edit yourself. So if you want to kind of explore that with things that you guys have got going on. But thanks so much. Thanks for partnering with us. Again, it's been certainly been a pleasure, and we'll look forward to partnering with you again soon.
Thank you so much. I appreciate it.
Take care. Bye now.
Bye.